where Agency Director Ed Byrne is standing by. Mr. Byrne, good morning.
Good morning. How are you?
Doing well, sir.
Yeah, doing pretty good. Ed, 8:25. It's Tuesday, August 10th. Just wanted to bring you on to kind of follow up and, as per the Communications Director, Crystal Paco San Augustine, get a little more clarity on this executive order. I know that she was tracking that you guys were going to come out with a memo relative to this EO. That's not out yet, but what can you tell us about this EO and the implementation of it?
Yes, it's not out yet. We had a meeting, internal meeting yesterday, and we're working on it, and I expect to get a first draft today. We're putting some flesh on the executive order in order that line agencies in particular, but autonomous agencies can follow these guidelines if they wish, can put some flesh on the bones of the executive order so that department heads know what to do and how to treat their employees. I guess the two most important things is that we're trying to make sure that everybody in the executive branch in particular, but throughout the government in general, is vaccinated. And if they're not vaccinated, that they understand that they have to undergo a weekly test in order to make sure that they're not positive.
So is it an option then for autonomous agencies to follow this executive order?
Yeah, the governor has, on the executive order, has asked the autonomous agencies to follow. In fact, in her statement, she asked the autonomous agencies to follow. And that's why in framing these rules, we're trying to make sure that they cover the autonomous agencies in the expectation that they will, in fact, adopt the rules as written.
And are for those who opt for the weekly COVID test, are they going to be given comp time or leave time to go and get that?
Yes, we're going to. Yes, they are. As indeed for those that opt to finally be vaccinated. And I should say, as far as I can see, in many agencies, a large number of people, and by far the overwhelming majority of people, have been vaccinated. But for those who have finally, and I noticed in the newspapers today, there are some that have decided at this stage that the vaccination would be advantageous. They get time off to do that, and there will be time allowed for those who have to take the weekly test. But we're also trying to make sure that we bring the test to them rather than have to wander around trying to find appropriate place to get tested. And we're working on that with public health.
We had the Mayor's Council of Guam president on yesterday, and he was kind of waiting to see whether or not this executive order would apply to the MCOG. Can you provide any clarification on whether, in fact, this does?
Yes, Sabrina. We've confirmed to the governor's office that the Mayor's Council is part of the executive branch and it will apply to them.
Okay. There was something else on the executive order regarding disciplinary procedures, disciplinary action. What kind of disciplinary action are we talking about if they don't get vaccinated or don't refuse to get the weekly COVID test?
Well, the purpose of all this is to protect both those in the government who have decided to get vaccinated, and for those members of the public that have to have contact with government workers to protect them. We're in the rules that we're drafting. We're suggesting, or maybe more than suggesting, we're going to instruct that the regular disciplinary rules will be followed. But obviously, if an employee both refuses to get vaccinated and refuses to get tested, we don't want them at work. So they will be excluded from work, and the disciplinary action, which we have to follow, will, as written out in the personnel rules and regulations, we will follow it from there.
And what about those employees who are unclassified that, are subject to disciplinary action? Because I know it works a little differently for the unclassified, right?
Yes, but in this case, we're not. The executive order is quite clear that it covers everybody, temporary, classified, unclassified, or however they're employed. And therefore we will follow the same procedure.
Has your agency been on the receiving end of any concerns or calls from executive branch employees about this EO?
None that's reached me so far. I mean, the executive order is fairly clear. We're just trying to make sure that we get some rules for agencies to follow. I think all employees in the government should be fairly well, should understand thoroughly that this is a protective measure to protect employees and people of Guam, and it's required that they follow it, and we don't want to unnecessarily endanger anybody. We've seen an increase in positive cases in the last few days. And we certainly don't want to go back into some of the numbers that we had. Unfortunately, hospitalizations remain low, but why increase a risk when there's no need?
Are we good with the EO?
Not really, but.
We did have a comment, Mr. Byrne. If vaccinated people can pass the virus still, why not test them weekly as well?
Well, that's a technical question that I'm not really qualified, I'm medically qualified to comment on. Right. But I haven't heard, from the statistics I've seen, the number of both infected people and contact people from people who have been vaccinated does seem to be less. I can't tell you exactly how much. As I say, you'll have to talk to the experts about that. But it certainly does seem to be less than those who have been unvaccinated.
How long do you anticipate the implementation of this EO to take? I mean, you said you're drafting regs now.
I mean, for us to, the executive order requires that employees either get vaccinated or prove they've been vaccinated by September 24th. So that's the date we're working to.
That's fully vaccinated, not partially?
That's fully vaccinated.
Right.
And what we mean by fully vaccinated is that they have received either 2 shots if it's a 2-shot vaccine, or 1 shot if it's the 1-shot Johnson & Johnson vaccine.
Do you have the vaccination rate for executive branch agency employees? Like, what's the percentage?
Yeah. How many people are we talking about?
We're putting that together now. As I say, I believe that it's kind of up in the, it varies obviously from agency for agency, and I can tell you at DOA, it's something like 97%. But it's kind of like as far as I recall from seeing the numbers, it's in the high 80s. And, hopefully, as we get through, people don't need to wait for September 24th in order to get vaccinated. Vaccinations are available today, and if anybody wants to, who hasn't been vaccinated, they should do so straight away.
Okay. Can we switch gears real quick? Are you looking forward to the budget session starting tomorrow? What are you anticipating?
Yes, it's a highlight of my year.
Wait, was that sarcasm? I thought yeah, that was sarcasm.
Well,
Got dry British wisdom.
Yes, very dry. Yes, I'm looking forward to getting a budget on the books. There have been a number of discussions that led up to the budget over the last few months. So let's get the budget on the books, which is, legally it has to be by August 31st. And so we can plan, agencies can plan, and financially we can plan for the next year. So I'm looking forward to having those discussions and hopefully getting universal and quick agreement to all the budget provisions so that departments, as I say, can plan and be sure what their finances look like for the next financial year.
And what are we
What's going to happen in the next financial year?
What are we going to anticipate? What kind of discussion tomorrow? Are you guys coming with numbers as far as like this agency is going to get this much from the ARP? Or are you only going to come and discuss a budget that does not include any of the $600 million in American Rescue Plan funding?
The ARP funds, as the governor has said several times, is a matter for her to decide how the funds should be dispersed. But I think it's important to remember, Chris, that these are ARP has the word recovery in the middle of it. They're meant to be recovery funds, not operational funds. The duty of the legislature is to compile and enact a budget that deals with the government operations. The ARP funds are meant for recovery. That's outside the operations normal purview, and that's something that the governor is still working with. And I think she spoke a little bit about the support we got from the U.S. Treasury to some of our plans, and I'm sure in the near future some information will be coming out. I mean, some information came out overnight on the Educational Stabilization Fund usage. So that was going to, all this information will come out, but it really doesn't impact the budget which is being considered by the legislature.
Okay, I thought it was American Rescue Plan, not recovery plan.
It is American Rescue Plan.
Yeah. So is that a no, that when you guys go to the legislature tomorrow when they ask about ARP funds, you guys aren't going to answer any questions?
Well, I don't think we're not going to answer any questions, because we'll answer a question when asked.
I mean, well, no is an answer.
No is one answer. I think we will point out what I just said, which is that this is a budget that deals with operations. It's a completely separate issue from ARP, whether it's recovery or rescue. Rescue sounds even more desperate, does it not? It's certainly not anything to do with operations.
Mm-hmm. Yeah, it is desperate because we've got people who've been waiting for RISE Act payments, and they're desperate to see that money. And
it's an emergency.
You spoke to Daphne about that, and she's working on getting that money out too. Over the past few months, certainly and I'm sure everybody in the administration is very well aware of the economic situation, and we've had several major efforts to get money into the hands of people. We've had 3 EIP processes out there to get money. We've had public health and DOA working on the program Salape, which got money into people's hands. And here at DOA, we're working on the rental assistance, the homeowners assistance, and the low-income water assistance plan. So everybody's working very, very hard to get money into people's hands. The RISE Act, I know people are concerned about, but that's just one arm of this octopus, if you like, that's trying to get money into people's hands. The unemployment, the federal unemployment assistance ends very soon. So I know we're working to try and get these RISE Act payments out, as well as, I think Daphne spoke to you about this, the child tax credit advance payments. we're trying to get out to. So there's certainly a big effort to get money out to people, not just people who qualify for the RISE Act, but for people generally that need funds all over, throughout the island.
Well, when are we going to see these monies spent, Mr. Byrne? Because we kind of are seeing these final guidelines. First there was public comment period ends July 16th. It's August 10th now. What's the timeline on you guys, in your mind, finally receiving the green light to spend this money?
Well, if you're talking about the RISE Act, yeah, that's a question you need to ask, and I believe you did ask Daphne about that. All the other funding, as I say, as I gave you an example of some funding coming out today from the Education Stabilization Fund. I have to say that what I understand from our discussions with Treasury, we're actually way ahead on Guam of some of the other states and territories, some of the other states and almost all the other territories. So, put in the background on this, Guam is doing pretty well in getting funds out into people's hands.
How much in ARP funds have we got out into people's hands?
That's a matter that we will talk about, no doubt, during the budget.
So have we spent any ARP funds?
Yes, we have.
We have? I thought we couldn't spend anything until we got the final guidelines.
We have been spending some money out because the meeting we had with Treasury a couple of weeks ago, we got some unofficial guidance because we asked that question. I mean, there wouldn't have been much purpose in meeting with Treasury if we didn't ask that question. So we asked the question and we got some guidance that we are working under because they were unable to tell us when the final guidelines were going to come out.
So prior to the meeting with Treasury last week, right, in D.C., that's what you're talking about, the meeting last week?
Yeah, it was the week before last, Sabrina.
Okay, so the week before last, has any of the ARP monies been spent prior to this meeting with U.S. Treasury?
No, I don't think so.
Okay. So how much was spent since the meeting with U.S. Treasury?
Well, as I say, that's a question we'll answer when we have the budget meetings.
Do you mean the session tomorrow?
Yes.
Okay, because I thought you mentioned that when it comes to ARP money, the administration doesn't really have to answer to the legislature because the governor controls that money and has nothing to do with the budget.
That's absolutely true, but I'm sure we'll be asked.
And an answer will be provided.
You can just tell us now, though. I mean, we're all here.
Well, I think it would be better to tell the legislature first. They're the lawmakers.
But you're confirming that yes, ARP money has been spent. Out of the $600 million that we got, money has been spent from it.
But it was only after you guys met with Treasury.
Let me be clear. We haven't got $600 million. We got $553 million for the state allocation. The remaining allocations were split in half between this year and next year. So although the total amount we're expecting to get is $604 million, that included the $14 million that's the capital improvement part that nobody has got yet. And we've only got half of the county allocation and the non-entitlement unit allocation. So we're around about $580 million.
So about $600 million.
In total receipts.
Okay, so
million, yeah.
Are you able to say what was this money spent on, like personnel or salaries or?
Well, as I say, I'd rather respond to the legislature rather than telling you in advance. I don't think it'd be fair on them.
So, 553 million in state allocation funds. You're saying we have about 580 million that we do have in the bank. And after the U.S. Treasury meeting, some of it was spent.
Yes.
But not prior.
I have to check exactly the times that was spent.
You said it was after the meeting, though, with Treasury.
Yes, I would have to check, though, exactly the time, because I don't remember whether it was around about that time. So.
Was there anything in your meeting with the U.S. Treasury that they said, no, you can't spend that money on?
Well,
like a hospital?
No, that would be, nobody goes into a meeting and says they're going to spend money and expecting the answer no. Everything we said, they said they would take into account. Spending money on the hospital was discussed, but they said this is a big appropriation of money. No one throughout the whole country, including states, had asked them that particular question in that particular way for that amount of money, so they were going to consider that. As indeed they said they were going to consider a number of other matters that we raised, and that they would get back to us.
What are the reporting requirements?
Well, I guess the answer, Sabrina, is no. Nobody said no, but nobody said that everything that we were trying to do we could go ahead without the consideration of these larger amounts that are being concerned. And you were complaining, you were saying, what are we going to spend the money on? And you just mentioned one of the things that the governor said that she wants to spend the money on, which is the hospital.
Mr. Burns,
I'm sorry, but did you guys present a plan to the U.S. Treasury, a breakdown of the ARP monies?
No.
But you did just say, okay, we want to, can we pay out the rise? Yeah. Can we pay out maybe not that way, but you did ask whether.
Right. The matter of the hospital, as I say, was an important issue. It's important to the governor. It's important to Guam. And they said that this was a unique request and that they were going to consider the matter and get back to us.
What's the big deal, though, Mr. Byrne? Because obviously I'm pretty sure that, there's been a lot of outcry from the public and from the senators about not just when we're going to spend this money, but what we're going to spend it on. I mean, there was a whole meeting with the senators and the governor, but now you're telling us that what you spent the money on is a big secret until you report it to the legislature. And
it's not a secret. It's otherwise we wouldn't be reporting it.
But I mean, you guys know that people are wondering when we're going to spend this money, and it just seems a little. I mean, why wouldn't you say that? Hey, yeah, okay, everyone, we spent some of this money.
Well, why would you? It's only you that asked the question in that particular way, and as I say, I think it's appropriate that the legislature learns first, rather than reporting these things through the press. If the governor's office and Crystal wants to make a press release and do it that way, that's up to them. But as far as I'm concerned, it's a matter that we should be reporting through the legislature first.
What are the reporting requirements for the spending? So how soon do you have to report to the federal government what you spent, the money that you can't tell us you spent?
The first report is, we can tell you, but you just need to be a little bit more patient.
We've been waiting months, Mr. Byrne. I don't know how much more patient we can be.
Then your patience is admirable, and I am in awe of your restraint. The first report, to answer your question, your substantive question, the first report to U.S. Treasury is due August 31st.
I'm gonna get a
It's
medal
coming
for
up.
my.
It's
I
coming
gotta
up.
get a medal for my admirable patience.
So that
Oh.
first report due August 31st will indicate how much was Guam
Yes.
spent. Okay.
Okay.
Yes, yes, exactly.
And tomorrow, unless we find out at the press conference today, you're going to tell the senators what the ARP funds were spent on.
Right, well, I've just got a notice that the governor's having a press conference at 1:30.
Right.
So I am sure you and your colleagues will ask that question, and the governor will respond as she thinks fit.
All right. Any update on the financial management system?
Well, I don't think much happened while I was away, so I'm coming back and I'm trying to move it along because it's really important for this. So I expect to be able to get it out this week.
Okay. I thought you guys really needed this, like as an
We
emergency,
really need it,
especially
but-
when the first report's due on August 31st.
Yeah, we'll have to make that report without it, but we do really need it. Absolutely, we really need it. And I think, as you know, I've been very keen to get this in place as quickly as possible. But having said that, procurement in the government of Guam is a very long and involved and almost frustrating, I have to say, process. And so rather than get frustrated with it, we've just been trying to work through and make sure that all the barriers that exist, real or imagined, are removed, and we get this new system that and in that I think I deserve the medal for forbearance, because this has been going on for 30 years. That's longer than you've been waiting, Chris, right? Yes.
Yeah, I guess literally.
Yeah.
Yes.
All right. I guess we'll wait for the memo coming out
Right.
on the executive order. Wait to see
Yes,
what
I'll
happens
get it
for
out
the
as
budget.
quickly as I possibly can.
Okay.
Okay,
And we'll probably see you at 1:30, right?
probably. Are you going to be there?
Yes.
Okay. All right,
Oh.
Mr. Byrne.
Wait. You're gonna
Thank
be
you.
at the press conference?
Yeah, because it's about the DC trip.
Oh, okay.
It's about the DC trip.
Was there any other unique items then that you guys presented to U.S. Treasury that they're considering or looking at or reviewing?
Well, then ask that question this afternoon.
Thank you, Mr. Byrne.
All right.
Have a good day.
You
Okay,
too.
take care.
See you later.
Thank you for your patience.
Oh, always. Plenty left. I'm just getting started with the patients. Oh, at least we could laugh about it, right?
Yeah.
That was kind of a big reveal, though. It's like, aw shucks. Like, aw shucks, hey, we spent some of that money. Oh, these senators tomorrow morning, boy, as soon as Mr. Byrne walks in the building, they're going to be like, hey, heard you on the link yesterday. What do you think of that, though, guys?
I wonder what it was spent on.
Yeah. Why should we be asking out loud? Why should we? Right? I mean, again, you got to communicate to your people. And that's probably what they plan to do at this press conference. And that's why Mr. Byrne couldn't say anything, because they want the governor to be able to say whatever it is that's got to be said. They don't want her thunder to be stolen. Yeah, that's what it is. And so that's why he knows. I mean, he clearly knew, but he can't share it with the public because he'd get in trouble with Adaloop. And that's what kind of system we're working under, guys. It's 8:55 on the link. Ooh, we're coming.
So we're going to go from patients of one kind to patients of another kind.